Do you know eating fruit is not always a good idea to your gut health? Fruits are packed with fiber, vitamins, minerals, and antioxidants. However, there are evidence-based reasons why you might want to think twice before reaching for that fruit bowl. Are you feeling gut-related symptoms like bloating, gas, diarrhea, and abdominal pain after eating fruits? This may be because you are having difficulty in absorbing fructose, a type of sugar found in fruits like apples, pears, and mangoes. This condition is known as fructose malabsorption. Studies suggest that if you eat low fructose diet, which involves avoiding or limiting high fructose fruits, can help alleviate these symptoms. Here are some fruits generally considered better tolerated if you have fructose malabsorption. Number 1. Strawberries, low in fructose and high in fiber. Second one, blueberries, moderate in fructose but generally well tolerated in small amounts. Third one, raspberries, low in fructose and good source of fiber. Number 4, bananas, moderately low in fructose and easier to digest, especially when they are not overly ripe. Number 5, cantaloupe, relatively low in fructose, though it should still be taken in moderation. Number 6, kiwi, contains less fructose and often better tolerated. Another reason for you to get bloating, gas, and diarrhea after eating fruit is irritable bowel syndrome. Certain fruits contain high level of fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, known as FODMAPs. So if you have irritable bowel syndrome, a low FODMAP diet is good for you. So in your diet, restrict fruits like apples, cherries, mangoes, and watermelon. This helps to reduce your symptoms of irritable bowel syndrome. Evidence-based recommendation for you to managing irritable bowel syndrome is incorporating low FODMAP fruits such as blueberries, strawberries, grapes, and kiwi. The next gut-related condition is known as SIBO, small intestinal bacterial overgrowth. Studies have shown that in case of SIBO, certain sugars and fibers can feed the excess bacteria in the small intestine, causing you symptoms like bloating, abdominal pain, and altered bowel movements. If you have SIBO, following a low FODMAP diet can be helpful in managing symptoms. Fruits that are generally considered safer and less likely to cause SIBO symptoms include blueberries, strawberries, kiwi, and pineapple. The fourth reason why you should consider eating fruit is histamine intolerance. Histamine is a compound found in certain fruits like bananas, strawberries, and avocados. Some of you may have difficulty in breaking down histamine. This can lead to symptoms such as headaches, skin flushing, digestive discomfort, and nasal congestion. Apples, pears, blueberries, cantaloupe, mangoes are lower in histamine and less likely to trigger symptoms. Fifth one is diabetes. If you have diabetes or insulin resistance, certain fruits with a high glycemic index like watermelon or ripe bananas can cause rapid spike in blood sugar levels. Research suggests that you can select fruits with a lower glycemic index, such as berries, apples, and pears, and consuming them in moderation. Sixth one, acid reflux and gastroesophageal reflux disease, known as GERD. Acid reflux and gastroesophageal reflux disease are related conditions involving the backflow of stomach content into the esophagus. Acid reflux. This is a common occurrence where stomach acid flows back into the esophagus, often causing symptoms like heartburn, re-agitation, and discomfort. It can happen occasionally in you. GERD. This is a chronic, more severe form of acid reflux that occur at least twice a week. It can lead to severe complications including esophagitis, stricture, and Barrett's esophagus. Eating fruits like oranges, lemon, and grapefruits can aggravate acid reflux or GERD symptoms in susceptible individuals due to their acidity. Studies suggest that if you have GERD, you should avoid or limit intake of these fruits. to help reduce symptoms like heartburn and indigestion. Fruits can play a mixed role in managing acid reflux and GERD. Some fruits may help soothe symptoms, while others can exacerbate them. Fruits that may help: bananas, they are low in acid and may help coat the stomach lining. Melons, such as watermelon and cantaloupe, are also low in acidity. Apple and pears, generally mild and can be less irritating. It's essential to monitor personal reactions to different fruits and adjust your diet accordingly. Number 7. Oral allergy syndrome. Oral allergy syndrome, a condition where some fruits can cause you itching or swelling in the mouth or throat due to the cross-reactivity with pollen allergen. You may have to consider before eating fruits such as apple, peaches, cherries, kiwi, melons such as cantaloupe and watermelon. Cooking or peeling fruits often reduces the allergen's protein, making them safer for consumption. Consider fruits less likely to cause reactions like bananas or citrus. Last one, candidiasis, also known as yeast overgrowth. Candidiasis, often caused by an overgrowth of candida yeast, can be influenced by your diet. While fruits are generally healthy for you, some are high in sugar, which can potentially feed candida. You may have to limit or avoid high sugar fruits like bananas, grapes, and mangoes, including low sugar fruits such as berries, green apples, and citrus fruits in moderation, help in candidiasis. While fruits are generally beneficial for your gut health, if you have specific conditions, avoiding or limiting certain types of fruit is good. It is important to consult a healthcare provider, a dietitian, to make changes in your diet. Thank you for watching. If you find this video useful, please share this video with your friends and family to keep their gut fit. Please subscribe my channel NutriHealth Pro to learn more interesting factors about gut health.